Hello, good day. I am Dr. Balaji. I am cardiologist practicing at city of Hyderabad. Today I am going to briefly educate you about the chest pain. Chest pain is one of the commonest symptoms that I keep seeing in my daily OPD. Different spectrum of age groups come to me with chest pain, from very small children to the elderly people. People are very confused about the origin of chest pain. What I mean, if any kind of a chest pain any place in the body, they think it is something to do with the heart. They are going to get a heart attack. It's going to be a serious life-threatening condition, and few of them come with such a kind of panic that they are going to collapse. Fortunately, all chest pains are not heart pains, and then today we are going to learn which kinds of pains are heart pains, which are not, when we need not go to a doctor, when we can just relax, one need not get panicky. And then probably we can also assure our friends, colleagues, family members if they have chest pain by gaining knowledge from this lecture. See, once you have a chest cage, the chest cage basically contains what? We have a skin, we have a fat tissue below that, we have a rib cage, we have a sternum, a vertical bone in the middle, and we have nerves, we have arteries, we have lung tissue on either side, and we have heart in the middle, and we have some blood vessels coming from this. So let us go one by one. Heart, we know that is important organ which keeps pumping the blood all through our day and night, and then the heart itself should get blood supply from arteries. These are called as coronary arteries. Once these coronary arteries are flowing and supplying the blood to the heart muscle, then only the heart keeps pumping effectively without any pain. So let us just go to what are the causes of chest pain. What causes chest pain? The first thing, as I said, is the muscle symptoms. So we know that chest wall is made up of muscles, and when these muscles become sore, when they become sprained, strained, when you lift a weight, or you have a kind of a trauma tissue, you join the gym, or you lie down in the bed on that particular night in a bad posture, you can get some kind of a pain. So if somebody gets chest pain only during these activities, we think it is a muscle pain. One need not be panicky. It's not heart pain. Okay. The second pain is joint pains, or what called as Costochondritis. This is one of the very common pains in the practice. The middle bone, this is called as breastbone or sternum, hinges at the ribs through a joint. That's how when we breathe, our rib cage moves through a hinges or joints. So this is called as costochondritis. This costochondritis is nothing but a joint inflammation. You see that red spots, these are the inflammation. That means if there is an inflammation in these joints, you will have pain. The pains are localized. There in the area not more than fingertip. They increase with pushing or pressing the chest, and also they increase with a deep breathing. So if this kind of pains are there, this can be because of the viral illnesses. There are innumerable unknown causes for these kinds of problems. Pushing the weights, lifting heavy weights, this can cause these symptoms. So don't worry, these are not heart pains. The other problems nowadays we are seeing more with the software professionals who work systems, and professionals who sit and do a job like clerical jobs, is spondylotic pains. This is the spine. We have a spine which comes from the brain, goes up to the coccyx. This is the spine, which is a series of bones arranged one above other like boxes, and but from between these boxes you get the nerves. This is called as nerves. These nerves supply the chest in a manner where each nerve supplies a specific area. For example, these are the different colors that you are seeing in this diagram. These are supplied by different nerve roots. So each nerve root supplies an area of the chest. So when this kind of a nerve root gets compressed, for example, C5, C6 nerve root gets compressed, you feel pain along the hand. So many of the patients come with, the software portions come with the pain that just goes along the hand. So this pain, and we know by convention that the heart pains can go to the hand, and it's a popular belief, even though there is no complete truth in it, that the heart pain always goes to the hand. Most of the times when somebody complains of only pain in the hand, especially in the neck, especially here in this region, This is basically a nerve root compression because of cervical spondylosis. As you see this, as I said, the spine is a series of boxes of bone. From in between the nerve roots come. When they get compressed, you feel this pain along the hand and also sometimes in the upper chest and also in the neck. If the series of nerves gets compressed, they can have pain all along, and sometimes this pain can also goes to the chest, and this causes confusion with something, a heart pain is there. But this is not heart pains. Please make sure that these kinds of pains are not heart pains, and these pains does not cause a heart attack. You see this in cervical spondylosis, whereas the pain goes. See, in this man, the pain goes to the clavicle, this collarbone, it goes to the shoulder, it also can go along the chest. So the pains can go all along the left upper limb, sometimes right upper limb, and maybe they are only in the shoulders, not into the chest or to the hand, or maybe little go down up to the arms. These are all cervical spondylotic pains, nerve root pains. These are not heart pains. One need not be worried about this kind of a pain.